Welcome back. 5 years after COVID-19 emerged from China, another mysterious virus seems to have had the country under its grip now. China is facing an outbreak of the human metapneumovirus, which is a respiratory virus causing flu-like symptoms. In fact, the virus, which spreads through droplets and close contact, primarily affects children, the elderly, and the immunocompromised individuals. Authorities have asked citizens to wear face masks and wash hands frequently. But what do we know about the HMPV at the moment, and what about the rising cases in China? Let's take a closer look. Now, if we first take a look at what exactly is HMPV infection, it is caused by human metapneumovirus. Its causes symptoms are very similar to common cold and can sometimes cause pneumonia, bronchitis, and also it impacts kids and aged elderly people can get severe symptoms. And we also are given to understand that this particular virus spreads through coughing, sneezing, also shaking of hands, and touching door handles, keyboards can also cause an infection.
I'm joined by Dr. D.K. Gupta, Chairman of Felix Hospital on the broadcast. Thank you, Dr. Gupta, for joining us on CNN News 18. Given the fact that all this alarm is being created over these rising cases in China, what can you tell us about HMPV?
The HMPV is not a new virus, I think, and we should not be panicked also. It was first isolated in 2011, and there were several outbreaks also last year. Also in US, it was isolated in more than 11% of cases of respiratory illness, actually. And out of total illness of respiratory disease, 5 to 15% accounts goes to this HMPV virus only, and not HMPV virus in this region. Other virus like COVID virus, rhinovirus, respiratory syncytial virus, coronavirus, and there are adenovirus. There are so many upper respiratory tract infections. They are caused by these viruses actually. The symptoms are quite common. That is running nose, stuffy nose, cough, fever, body ache, malaise, headache, chest pain, breathing difficulty, sometimes in complicated case. Mostly it is a mild influenza-like illness, but sometimes, especially in younger age group like less than 15 years of age group or more than 65 of age group, it can cause serious complications like pneumonia, bronchitis, asthma, COPD, acute attack, or ARDS, or sometimes lower respiratory tract disease also. These can occur in older age group or younger age group, or those patients who are immunocompromised, like suffering from diabetic mellitus, hypertension, cardiac disease, renal disease, kidney disease, or liver transplant, kidney transplant patient on dialysis. They can actually have severe illness. Definitely, it is not a serious concern right now, because most of the country right now monitoring the China condition. Even Indian government is monitoring right now. That nothing has been, something has been isolated that is has concern to us, I think. But we should all follow something preventive measures for every respiratory illness, like these are the respiratory hygiene and hand hygiene. I think we should avoid crowded places. We should have physical distancing or social distancing. We should hand wash frequently. We should not touch our nose, mouth, and eyes. And definitely we should not handshake. And if somebody want to go out with some emergency cases or maybe normal cases also, they should wear masks. Normal masks they can wear, preferably N94 mask. Or somebody who is having respiratory symptoms, like this time there are so many respiratory viruses are roaming around in our environment, and most of the people are suffering from the respiratory infections. They should definitely isolate themselves, and at least should wear a mask and do not go outside, so that the infection should not be spread outside. If we follow all these rules, definitely we can break the transmission of any respiratory infection. And we all know these respiratory tract infections, the mode of transmission is droplet infection, when somebody is coughing, is sneezing, or touching infected surface, or hand shaking, then it can be transmitted from one person to other person.
Right. And Dr. Gupta, when it comes to taking care inside the home or in the workplace, what should the common man have to prevent these kind of respiratory illnesses, given the fact that we're already living through so much pollution, there's so much congestion, so many respiratory illnesses are already floating around in the NCR region with all the smog and the pollution. Anyway, people have these air purifier machines in their homes. People are wearing masks because they've been trained by what happened during COVID-19. So what more measures can people take? Are there some supplements that people should take? Or at the same time, should everyone carry with them some cough syrup? What measures would you suggest to people to keep themselves safe?
I think the most important thing is that prevention is better than cure. We all agree on this point. If we prevent these illnesses, we can prevent complications also and deaths also in rare cases. If somebody is having these symptoms, they should quarantine themselves or isolate themselves. Healthy people, they should do something to boost their immunity, because if your immunity is low, then this infection can cause pneumonia, ARDS, and complications. If your immunity is high, then it will be limited to the upper respiratory tract infection only, and it will be like coryza or influenza-like symptoms only. For improving your immunity, you should have plenty of fluids, seasonal vegetables, seasonal fruits, dry fruits, 6 to 8 hours sleep also. If you are having these symptoms, go to doctor. If somebody is having serious symptoms, I am telling you again, if somebody is having these type of dangerous symptoms, then he should or she should immediately contact to nearby healthcare facilities. Like if somebody is having breathlessness, means shortness of breath, difficulty in breathing, chest pain, or like wheezing problem, or high grade fever, chills and rigors, or somebody is having very weak, or somebody is having low blood pressure, loss of consciousness, blue discoloration of eyes or nose or tips, then it means there is a complication of pneumonia or ARDS is there, or maybe it is there is acute exaggeration of asthma or COPD. Then he should immediately contact to the hospital or nearby center. Otherwise, this is a very mild illness. I am telling you, nothing to worry, nothing to be panicked, but we have to take all precautionary measures that we have already taken during COVID period, and most of the people are aware, educated. Just we need to reinforce these parameters, these measures through print media, electronic media, and through people like you, so that people should follow these rules and safeguard themselves.
Right. Dr. D.K. Gupta, thank you so much for joining us on the broadcast and sharing that crucial information, because even though, as you're pointing out, the HMPV virus is not a severe virus, you don't get a severe infection, prevention is better than cure. We have to follow those COVID protocols that we used to in order to stay safe, not just because of the rise in viruses, but even given the pollution which cause further health complications.